There are a variety of hurdles that impede progress in this field and translation of some of the basic discoveries to the clinic into commercialization. One of these includes the fact that when there isn't sufficient communication between the different groups, that oftentimes the basic researcher may start down a path that will ultimately not be translatable. So what I mean by that is when I start out with a particular technological or scientific goal, there may be multiple paths I can take. Maybe some of these are not, at the end of the day, going to be something that you could hand off to a company. They may not be able to manufacture a material. They may not be able to use a particular chemical in a human eventually. So by having early conversations, one can then pick paths that hopefully will minimize later hurdles that stop progress and make you go back to the drawing board. So that, I think, is one significant hurdle. Another hurdle that tends to be very important as well is that a lot of scientific progress today depends on increasingly sophisticated technologies. We all hear about things like genomics and proteomics and the other types of omics, for example. And to really use those tools effectively, one needs to have regular access to what, in essence, are very expensive tool sets. And so universities are trying to make these tool sets widely available to all investigators, but obviously that's difficult from a structural perspective as well as a financial perspective. But one is seeing that this is increasingly happening at universities and at companies, so I think that's going to be a crucial hurdle that hopefully will be overcome. Of course, the financial side, funding is always in limited supply as well, and increased funding for research and technology development will certainly aid and accelerate progress in these areas.
Clinical translation of inventions, that's something which more and more has become into the focus, and I think needs adjustment of the way we fund and organize research. In most universities, basic research is relatively well funded and very well established. But the step from the research result to a first application, for example, a first-in-man study, is very complicated because the infrastructures and the funding structures of our academic research are not prepared for this. So to fill this gap between invention, discovery, and application, we believe more infrastructure and funding has to be put into this translation, the last mile of translation, as we call it, or some people call it the valley of death in translation. So at the Wyss in Zurich, we have a very good first example where we have this funding from Dr. Wyss to move forward these technologies and to fund, for example, preclinical and clinical trials. But this is certainly something which needs to be extended and more established.